Hi, everyone. So many familiar faces. Thank you so much for being here. My name is Jessica Perlow, and I am the ABIM Foundation's Executive Vice President. Thank you for joining us for our first Trust Conversation of 2025. This webinar series is a core element of the Foundation's Building Trust initiative. And before we begin, I'd like to review a few logistics. This meeting will be recorded and shared, and while our presenters are speaking, we'll have the lines muted so that there's no unnecessary background noise. But there will be a chance at the end of the hour for our speakers to answer any questions you might have, and we encourage you to put your questions in the chat throughout the conversation. During this conversation, we're going to dive into how information flow shapes community engagement and civic health in today's digital age. We're joined by Jesse Hardman, the community media developer at Internews. It's a media support nonprofit that trains journalists, advances internet freedom, and helps media outlets become financially sustainable so that everyone has trustworthy information to make informed decisions. And Stefanie Friedhoff. She's the co-founder and interim director of the Information Futures Lab and a professor of practice at Brown University School of Public Health. And last but not least, we have Irving Washington, who made this webinar possible. He will be leading and moderating today's conversation. Irving is the senior vice president and executive director of the Health Misinformation and Trust Initiative at KFF, and he's a member of the ABIM Foundation's Board of Trustees. Thank you for joining us for what I know is a very timely and important conversation. And I will turn it over to Irving.
Thank you so much for that introduction, Jess. And we are excited to be here. And it's also very timely today to have a conversation on how information flows with the news happening today. You all could be anywhere right now, and I know we have busy schedules, so we want this to be informative and engaging. And if you've never been in a moderated, facilitated session with me, I like force engagement, whether you like it or not. So just so we know who's in the room today, let's do something. Just drop your name in the chat. And instead of saying where you're from, put what temperature it is in your location right now. So drop your name in the chat and put what temperature it is in your location, and we'll get our discussion started here today. While everyone is doing that, one thing that this was really, really exciting for me is that I think a lot of us are thinking about how information flows. I think there's amazing things that are happening right now in terms of the access of information and who can create content. I also think there's some things that are not so amazing in terms of how information flows and who gets access to that content. And so a couple of months ago, the folks who are you just introduced and we'll have a discussion with released the Civic News Index. And when I saw it, I literally got excited because for two reasons. One, just more information on how information flows. And then two, what really fascinated me about this was the fact that, depending on what field you're in, so I'm in the health field right now, I'm in a lot of rooms, we're talking about how information flows, but we're typically with other health professionals. Prior to my role at KFF, I was in journalism. So I was typically in rooms with journalism. And the thing that I love about this index is that you all put together so many different pieces from health to media to civic participation around what makes a healthy information ecosystem. So I'm so excited that you all are here to talk about this today. And for those in the chat, I see it's cold many, many places. No one's in a warm place right now. But for those in the chat, feel free to drop your questions as they come to you throughout the session, and we'll try to incorporate them. You don't have to wait till the end, although we will have a specific Q&A in the end. With that said, let's get started. Jesse and Stefanie, hopefully you can see my excitement for the index and kind of what I've already discovered in here in this conversation. It is a lot of information, though, so it's probably helpful if we just set the stage a bit to help people understand a kind of a basic overview of the index before we dive in further.
Great. Thanks, Irving, and thank you all for being interested in this topic and for joining us. I'm Jesse. I have a reporting background, mostly as a reporter in public media, and I hit a point a couple of decades ago where I was really curious about not just the impact of the journalism I was doing, but how to think a little more deeply about how to get it into the hands of communities in a more equitable way, not just to assume they're going to find my website or my newspaper or my radio station in my case, but to really like seek out their information networks and find ways to put journalism in it and then reflect with them on how that information was useful. So that kind of set me on a little bit of a different path than just doing my own reporting. I wound up working for the nonprofit I'm with now, Internews, and they work in 100 countries looking at this very issue. How do you make information that people need more accessible in all the forms that that encompasses? A decade ago, I started exploring doing that in the United States for the first time through Internews. And basically, what we do is we map community information needs. And the idea behind it is not to show up in a community with a news outlet and say you should care about this, but to show up in a community and ask the question, hey, if I needed to get you information about something, how would I do it? And B, what kinds of information would that be? What's missing from your information diet? So starting from that place of being curious and listening, and taking that information and building more reflective, equitable news outlets based on what communities are actually telling you. And so now what does that look like? That could be a WhatsApp group that's in Spanish. It could be using Instagram. It could be a direct delivery podcast in another language. There's so many different ways to reach people that we really kind of focus on this idea of what is an information ecosystem and how do you serve it? And I'll drop another link in here. We created strategies, a playbook for helping folks, not just in journalism, but in public health and other disciplines, how to map their community information needs and how to use those strategies to better inform people. This idea of the index kind of comes out of this same thinking. Teaming up with Stefanie, what the goal was how do you put the idea of news and journalism in a bigger context that might be a little more accessible to people? I think increasingly I'm realizing journalism can be a little bit of an abstract concept for a lot of folks, especially in the context of the modern internet where a newspaper is competing with everything from a Facebook group to Netflix. How do you get people's attention? I think one of the ways to do it is to consider what their needs are in a whole host of different areas. Again, thinking about public health as one of the most important spaces that people really kind of not only need information, but care the most. So the index is meant to take journalism, acknowledge its importance, but put it in a larger context of what are all the things that dictate whether a community feels civically healthy or not. What do those data points look like? What are the categories that they fit into? What does it mean when your community is civically healthy? And what role does journalism play in that? And so those were kind of the questions we started with. Stefanie has an amazing team of folks who know data, and so they went and sought out some of the available national data sets that could reflect those questions. And then we started building this index. And I think the last thing I'll just share at the outset here is an example of this, and we'll share it on the screen here. I was learning about a community in Tennessee the other day, Van Buren County. It's a rural county, and it came up in my Google search because it's considered a news desert. That's a term I don't tend to use a lot because even in places where legacy media outlets like a newspaper have died, people are getting and sharing information. They're just doing it in different ways than maybe a traditional journalist might think of. So this came up. Some people view it as a news desert. It has no official news outlets, which could be the beginning and the end of the story if that's the only thing you're looking at when you think about a community's information needs. But within this index, we've got 21 data sets that we're looking at, and we've got 4 categories, one of which is news related, but the other 3 involve civic participation, equity and justice, health and opportunity. And these really encompass all of those ideas around what are the topics that people need information about? what are the existing community spaces that they're using, sometimes in lieu of a formal news outlet. So in this case, when I went and looked at Van Buren County, what caught my eye was the volunteer rate is high. It's almost 50%. There's a really interesting national data resource around public good Facebook pages. So Facebook pages that are local and civically minded. There's quite a few in this county. And lo and behold, what's happening in this county, people are making up some of that gap from the formal newspaper going out of business a few years ago through Facebook. They're doing it offline. There's an amazing example of a local funeral home that used to publish obituaries in that paper, and now they have a sign out in front of the funeral home where they share that information. It's information people want, but they're doing it in a physical way, which I think is really interesting and by no means outdated. We're looking at library visits. In this case, that's low. In some communities, it's very high, and often it can kind of direct you towards a resource that the community is using that you might engage in order to get them information. So there's all sorts of clues here that are really exciting to us as people who are trying to solve this problem about making robust information ecosystems, even when there's an absence of what we consider kind of the traditional media that we all grew up with. So I'll turn it over to Stefanie now, but I hope this example gives you a little bit of a sample of kind of what we're thinking about and how we're contextualizing the use of journalism and the impact of it in a broader sense.
Thank you so much, Jesse, and thank you all for being here and spending your time with us. It's exciting to have you all and to engage and to think about, and thank you for being concerned about trust and for spending your time or investing, really. We are all now part of these information ecosystems. I run a lab at Brown University where we do nothing but think about trust and information ecosystems. And so this was a welcome project for us to engage on. But I also have this mixed background in both journalism and public health. And I spent the last 5 years nonstop with very little sleep, trying to help people access information about the COVID-19 pandemic. And I think we all were witness to what happened in that time from different vantage points. And I wanted to start us out with just 2 conceptual things before I explain a little bit more about the index and what you can find in it. One is really, and that was an intention for us with this project. We have this sometimes still this image that officials or scientists communicate to the press, communicate to journalism, and then journalism spreads it to the public. Well, now, sure, there's social media now, and there's others, who share some information. But what we call an information ecosystem here, what we mean by that is that there's so many more sources of information, and people increasingly go to those non-traditional sources for trusted information. And that includes all of you. We talk a lot about the role of doctors and healthcare providers in general, and nurses and community social health workers. All of those are information navigators. They're helping people in society make decisions and figure stuff out in this complicated environment. We also talk a lot in the trust conversation about polarization. And part of what we wanted to do with the index is focus us back on our common goals. Because what is it that everybody, regardless of where they stand, is concerned about? Their health, their future. Everybody has aspirations. And that's what we're trying to show in the index. It's like, this is what a healthy community looks like. People have a voice, they can participate, but also they're not so deep in medical debt that they can't even rent a car anymore, let alone lease a car, because their credit history is so bad. So this is why we went into mapping out this index along these lines that Jesse just showed. So the site is Civic Information Index, and Jamie, I will put this in the chat for you, so you can explore this, and we encourage you to explore. Under the index here, you can find this particular page, and when you navigate to it, first you will land on this map. This will be beautified, so this is a better version right now. We wanted to share this as quickly as possible as we have it. And this shows you the darker colors are really where, according to our index, civic health is higher, and the lighter colors show where civic health is lower. And these are not surprising areas. The Appalachian Mountains, these are communities where 30 or more % of the population are Black and brown. You can clearly, these are reservations up here. So the map already tells us a lot of things that are important. And then when you go to these indicators, as Jesse has shared, we have organized this universe into these 4 pillars of news, civic participation, equity and justice, and health and opportunity. I wanted to briefly explain why we have equity and justice in here. You see in a lot of these projects that the map is shows you different types of disaggregated data, for example, by race and ethnicity. And what we're trying to show here is not what race you are of, but rather what the factors in our systems that contribute to discrimination. And that shows the outcomes. And then you can map it with that demographic data to see what populations are disproportionately impacted. But we really want to measure those outcomes rather than, again, where you live or other ways of looking at it. So that's an important part of this. We encourage you to play around with this. I'm sure there's a ton of questions about why did we choose these and not other indicators. What are we learning as we talk with more folks about it? So I'll hand it over to Irving so we can get into a vibrant conversation.
Thank you, Stefanie. And you're already doing some of my job already, because that was going to be one of my questions to kind of kick it off, is just to focus on the indicators and kind of think through, walk me through, Jesse, to chime in, if walk me through that process, because there's a lot of indicators that you could have picked. I'm sure perhaps some people argued for, another indicator being in there, but walk me through that process. And then if you can also just walk me through the interconnectedness of them and how you see that.
Yeah, fantastic. Thank you, Irving. So traditionally, when we look at civic health indices that are out there, they come from this world of census data. They look at voting participation. They look at maybe the average literacy score. They look at social associations, and they look at how people are contributing. Are they volunteering and are they giving money? We thought that was a limited view of thinking about civic health to begin with, let alone information or the larger space here. When we think about news and news media ecosystems, we have this news deserts data. In journalism, that is already not enough data to really understand what kinds of credible information sources are out there, but we're missing all the other things I just mentioned. We're missing, are people going to the library to ask questions? Where else are people having conversations about things, and who are they getting their information from? So those items in the news and information part of the index, again, Facebook pages, we're trying to map out. It's very, very hard right now to get social media data. So we're just trying to find one indicator that could help us understand where community is discussing online, and are there ways more of this happens versus less? So that is that one data point. Then we clearly wanted to make a statement, as mentioned, about outcomes. We wanted to show that not all lives are lived equally in the United States. And at the same time, it's hard to make large summaries about this, because you can see when you look more closely into the index that 2 neighboring counties can have vastly different outcomes. And we know this, like rich and poor, privileged and underprivileged live very in close proximity, often in communities across the United States. So we were trying to show this. This is in part based on research that shows that if you work 3 jobs and don't have transportation, you may not have time to go to the community meeting. You may not have time to read the New York Times. There are all these different barriers for civic participation, and those varying information items are a barrier. Language included, which is why we include % of people who speak a language other than English at home. And then we include the social determinants of health for reasons I think that many people on this call are familiar with. around the basic drivers, such as the percent of people who are underinsured or uninsured with respect to healthcare, educational attainment, such as bachelor degree and so forth. We picked these 21 indicators because there's a lot of dashboards out there. And there's a lot of data. We need to, as when we do these projects, we have a responsibility to make sense of the data. If I gave you 150 indicators, what are you supposed to think about? So these indicators are really meant to be an example. You can take an unemployment rate, you can take different economic indicators. And we're probably going to exchange some of these as we build out the index. But we were trying to create an image to show a picture of what civic health looks like. Even if one specific indicator could just as well been a different one, they should tell the same story, and we're trying to tell that story with this index.
Thanks for that context. It's really helpful. And Jesse, I'll turn to you. Given the vast amount of data, this is looking at across the country. As Stefanie said, there's a lot of data that you looked at and had to determine the indicators. What hit you the hardest kind of from here? What really stands out? I know there's several key findings, but for you and the work that you've done, like what's hit you the hardest from the work with the index in terms of the findings?
I think, when I look at it, I look at kind of the places in the US that a project like mine is trying to have impact in, and having some more insights into what it's like to live in that community is really important. It's essential. I feel like often we go into a community, whether we're a public health person or a journalist, and we're curious, but I think that sometimes there's a bit of a lack of preparation to actually, know a little bit more about the spaces that we're interested in working in. I also start to see things like if you look at the border, like there's a county in Arizona, trying to think, it might be Santa Cruz County. If you look at it, that indicator, that data point on language, 80% of that county speaks a language other than English at home. Now, presumably that's mostly Spanish, or potentially there's some indigenous dialects there. But if you then go and look at what kind of bilingual media or Spanish language media there is in those areas, formal media, you're not going to find much. And it's just such a striking number because it really leads you to see kind of the lack of effort to really reach communities sometimes. And it makes me, as a researcher, really interested in going and visiting and figuring out, well, people are getting information from somewhere. Where is that? Is it a library? Is it a WhatsApp group? Is it a Facebook group? It's probably a little bit of all of those things, but identifying what that looks like in that place and how to partner with local people who are managing those sorts of resources to put journalism in that space, to put public health information in that space. So it's really just each place you kind of learn something slightly different when you take a look at the index. And there's always something. I think the other thing that I take away from this, there's always somewhere to start, some data point that really helps you see that community for the assets it has. I think some folks think of an index like this to show you kind of where things are going horribly wrong. And I try and look at it as, a place where there's a lot of opportunity, but also there's something there. There's a place to start. And once you identify what that is, then you can start kind of building something with the community, hopefully that's sustainable and long-term and useful to them. But you always find something. So that's kind of where I reject this idea of a news desert. Like, people are doing something to communicate, and there's an interest and a desire to have information, to improve their lives, to be healthy. So yeah, how do we prop that up? How do we support it and start, instead of showing up with answers, I think is kind of where I land.
I love the framing of there's a place to start. And that's what I saw in the index too, because the indicators that you're looking at, again, to your point, Stefanie, that could have been others. There is a place where people are getting information. Stefanie, I do want to pull back on something that you said, though. There was a line in there where you mentioned, people are getting news course, from a variety of different sources, not just traditional media. And I think you even said, you on this call, you are also a source of information, and that you are providing this, and that you are a source. I'm going to channel somebody on here. I don't know, maybe more than one somebody, but somebody's going to say, I am competing against X, Facebook, podcasts. I'm competing against all of these things. How am I really breaking through the message with these kind of larger platforms? And what insights I think can the index pull to sort of, for somebody that's thinking, you know, there's so many information sources, like how am I really competing with that?
Yeah, I'm gonna start with Ingrid's comment in the chat here, which is one thing I noticed from my mother and in-laws with English being their second language is that a lot of information comes from their religious groups. Tying that together with what Jesse just said is we often think that all the traffic that's happening on social media is what's most important when these conversations at home, and the data bears this out around people increasingly trusting folks in their community, friends, family, and so forth with their information. So I think the first response would be, I think there was a time when those social media platforms were actually uniformly more influential than they are today. We want to remember that we are in a moment of such rapid change that we are, as human beings, constantly adapting to this environment, and how we engage with social media today is very different from 5 years ago. For example, we're better trained now to look at some of the content that's misleading or false as entertainment. And of course, that's not true for everybody all the time, and I'm sure there'll be a misinformation part of this conversation at some point. But when it comes to this, that feeling of being overwhelmed is real. But if social media is not your space, then use the other spaces where you already are and are engaging. But get out into the community, and that also includes in real life or in person, or when you have conversations with patients or customers or whatever. So ultimately, all communication is relationship based in one way or another, and that's where that starting point is. I think the index can really help us see that, because if you look at the library data across the country, a lot of people go still to the library. We forget about this. A lot of people engage in their social organizations. So I think that's a really important starting point. And then there's also the good old thing we need to remember, even if it's a small group on social media, it's a group of people that you're having a conversation with. Not everybody needs to have a large following to have impact.
One thing I just wanted to add to that, and I'm thinking of your question here, Renee. Some of my colleagues do a lot of research in Latin America around how people make decisions to migrate, where that information comes from that they use to make that choice, to pull it off. And what they found was social media was one of the primary forms of the information that that they were using to actually make their way, TikTok in particular, but that they didn't trust those channels. And I thought that was really interesting. They were separating out trust from kind of what information was available. The actual trusted information came from family members, either in the US or in their countries of origin. Those were the actual resources that they trusted. And so it was just really kind of, you're talking about a group of people who desperately need information to stay safe and healthy. They're relying on social media out of necessity because they don't have other sources for that. But the trust actually is within their own kind of smaller circles. So, yeah, I think I hear echoes of that same thing here in the United States. People rely on social media, but it doesn't mean they trust it. Trust, like when we survey communities, I would say human beings, family members, public health clinics, community organizations often rate higher than just, your average social media platform still.
It also tracks with data that we have at KFF, and we can drop it in the chat as well too. In our misinformation and trust survey last year, or actually in 2023, We did find that people do come across information, quite a bit of information on social media, but the majority just really don't know what to believe. The majority are really kind of stuck in that middle. We tend to focus on we as in the broader public tends to focus on the extremes of people either who believe kind of far left or far right. But the majority of people kind of are in the middle. And we've also done some data with how people come across information on TikTok too, which we can drop in the chat as well.
And just to add one tiny thought to all of that is it is just really very different based on the population. So we can't make any general statements about this because for some, the WhatsApp channel might be the lifeline that provides trusted information.
Now, one thing that was interesting to me in one of the findings, we typically tend to think the more media in a community, the better. But you all found that more media outlets don't necessarily mean healthy communities. Can you kind of elaborate on that?
Well, yeah, there's a ecosystem out there of news sites, for example, that pretend to be local, but they aren't really. There's an ecosystem out there of so-called pink slime sites, which are AI-driven websites that have one political leaning or another. Both sides of the US divide do it, but one more than the other. So it is hard to distinguish from a cursory look because a lot of these sites try to look like very localized news, but we don't actually know if they're providing any localized news. And that is also true for traditional media, where increasingly larger conglomerates have bought up stations and then they just get fed the content that goes into all communities and there isn't necessarily much local content left. That is one part of this. So it's also important always to think about our information ecosystem as one that is run by different businesses, and what we are looking for and what we're also driving towards with this index is an investment in local sources of information that are really committed to community and to that civic health goal, as opposed to just making a quick buck from eyeballs on a piece of content.
I think it's also, do the existing outlets reflect the community they're actually serving? And, ask any immigrant or BIPOC community, like historically, a lot of those folks haven't been served by legacy media or covered in ways that felt reflective or equitable. And so often those communities have created their own media outlets to actually serve those populations. But you can have a couple of outlets in your community and feel completely ignored or misrepresented. And so I think that's also what we're getting at when we kind of share that idea, like the actual number of outlets doesn't mean everybody's informed or covered or listened to.
Keeping with that thread, you all, obviously one of the indicators is equity and justice. And at the beginning of the presentation, I think we looked at the map and some things were noted, like the data supports where we would expect there to be some information gaps. I'm curious, are there things in the index to discover where it's a little bit more surprising in either regionally or with a specific demographic that not necessarily is completely opposite of the data, but just a little bit more surprising in terms of now that you've mapped it according to these indicators?
I'll just throw out one from that previous link we were looking at related to the county in Tennessee. It actually had a pretty high percentage of people who spoke languages other than English at home. And I think when I look throughout the country, I'm always surprised where that indicator is high. Like it's just, it's so spread out and in places that you just wouldn't imagine. And you really begin to see kind of the story of how communities in the US have diversified, migrated, changed. That indicator to me, that data point is such an interesting one to keep an eye on.
I will share a very quick example. Irving, love the question. So we're working with the North Carolina News Fund, the leader of which is amazing to begin with, Lizzie Hazeltine, but also immediately said, oh, this index is great. It can help me to stress test my assumptions. At the local level, we all think we know our communities, and sometimes the data can tell us things that we haven't yet been able to see. So this is the data for Washington County, North Carolina. It is on the coastal side in the northeast corner of the state. And when you look at this data here, the light green is the civic participation index. So for a traditional way of looking at civil health in this county, you would see voter turnout, okay, you know, it's 50. So this is, by the way, in comparison to all other counties in the data set or in the country here. So voter turnout is about the middle, but, you know, lots of social associations, volunteer rate, all of these numbers, you know, come out to at least a 50% score. If you were to just look at that, you would say, okay, it's doing about medium, but look at the other numbers. Look at the social outcomes here for equity and justice at the very bottom of the 3,200 counties in the data set. Look at the social determinants of health. But you would also say, if you look here, okay, you know, people are going to the library. So here are your opportunities that Jesse was talking about. Libraries is where you can find all these people, right, who are facing significant adversity in their lives. Large population speaks a language other than English at home. Average literacy scores at the bottom here. So I think those are the kinds of surprises that we see in the data, where if you just look at one slice, it looks okay. But if you look at everything in connection, you see where the challenges are. And this is also why we hope, like we've been asked, you know, to make big statements about where in the country is civic health the worst and where is it the best. That's not the purpose of this tool. The purpose of this tool is we all need to look at our own communities and sort of report out this data and see what's happening.
That's also a good segue. I think we're going to try a live one. If people want to drop into the chat, we'll ask one or two questions first. But if there's actually a community that someone wants to drop in the chat that you want Stefanie and Jesse to kind of look at from a civic health standpoint, if anyone wants to be the brave one to dare, please drop it in the chat. But while somebody's doing that, I'm also curious that, you know, particularly with the audience that we have here, medical debt was looked at, health disparities were looked at. Can you just amplify that a little bit more in terms of how that played into the civic health of a community?
Yes, happy to, especially for this community. I think there are important conversations happening in the nation around how healthcare and public health are serving people. We know that health is a major building block of a happy life, a prosperous life, and an ability to participate in society. And looking at health outcomes then is an important part of understanding how people are faring, and also what is their potential to participate in society. And for those reasons, we decided to include the social determinants of health. There is strong data that shows the connection between health outcomes and civic participation. And there are also a lot of newsrooms already where the community has brought this to the table, where they are using different frameworks to think about health, to think about belonging. This includes mental health, obviously, to think about belonging as a way of refocusing the journalism that we do on what matters to the community. That's one part. And then there are also some health, so there's the health and opportunity pillar, but there's also some health data in the equity and justice pillar, because life expectancy is the ultimate outcome, both for health measures and, you know, you're not participating in society when you're no longer with us. So communities that face significantly lower life expectancy challenges, I think, that's an important way of looking at how we're doing. Is that helpful, Irving?
Very helpful. And then we can prep Minneapolis. I believe that will be. We don't have to do it right now, but just prep Minneapolis. I think Hazel was a volunteer there. I did want to bring in the conversation around where does misinformation, misleading information, where does that fit in this index, or how you all look at it in your work, or with the index individually, or how you're thinking about it in terms of just civic health overall.
Can you take that one? I'm Googling which county Minneapolis.
Thinking about my response to that. It's a loaded term at the moment. Yeah, I mean, I think I mentioned earlier this playbook that we created for mapping community information needs. One of the things we're trying to accomplish with that is to have people share with us kind of when they feel confused or what kinds of spaces in their community are they seeing information that they're not sure if it's true or not, and take a look at some of those spaces. I think it's also increasingly how do you connect with people in person to the best of your ability and create kind of that engagement? Again, trying to take things offline a little bit where there's so much competition and confusion, and connect people to resources within their own communities that they feel a little more confident or trusting of. Um, but yeah, I mean, we actually have kind of reworded it to be information integrity. And I'm happy to share some tools with you all when we're done here that we have for kind of looking at mis and disinformation, how to identify it. Um, One other thing I've been trying is we did an experiment in a community in the Inland Empire, so just east of Los Angeles. And we had a community media literacy workshop that met for 5 straight weeks. And one of the things we looked at was learning how to identify misinformation, what to do when you're not sure if something is true or not, what kinds of people can help you verify that information, and creating some resources for people. Um, yeah, so they do have a sense of like, I'm not sure if this is true, literally. Like, um, could you develop a resource in a community like a community editor, somebody with a journalism skill set, uh, one of their roles is to, yeah, take questions like that and respond to people. Um, Pre-bunking.
Just to, yeah.
Yeah, that is another way to refer to this.
Just
But
to
yeah,
add to that, Jesse, I think, and frame it a bit more, the index is meant to show us all who are all the players in the information ecosystem, because we often work in silos. And by doing so, and by showing us where some of the opportunities and vulnerabilities are, this is how we build misinformation resilience. So by the newsroom discovering, oh, we are trying to provide information about the H5N1 ongoing outbreak right now, and also the community organization over here is doing that, and also the local health department is doing that. How are we all getting to the people who actually need that information? And how do we, because right now, if we want to be a little crass in the example, right now we're all doing this in English only, and we're doing this on platforms where people are not spending their time, and we're doing it without the cultural context and literacies that are needed for people to get that information. We're constantly discovering in our work all these information barriers. Information is a social determinant of health, and information inequities exist. So by working together, we don't all have to descend on community to do the assessment of where do you get your news and yada, yada. We can work together to better understand how to service those communities with information, which builds misinformation resilience. The vulnerability to all those things, to a lot of these things, comes from a lack of information. And then, as was said earlier, it also brings us back to the trust conversation that's at the core of this webinar series. It comes then from the utter confusion about the issues and not knowing who to trust, and trusting the people who are close to us, that sort of we can touch and have a relationship with. So the index is meant to help all of us in, in our various vantage point and roles, connect these dots and better engage with people to get them the quality information that they need. Shall we look at Hennepin
Let's
County?
look at Minneapolis for Hazel. And also, while you're doing that, there's a question around how do we know that these attributes translate into sort of media opportunities? And maybe you can overlay that while we're looking at Minneapolis.
Minneapolis. Okay.
my hometown.
That's your hometown?
Looking good. Yeah.
Minneapolis is looking good.
Not surprising.
Well, I think, again, seeing this, sometimes what happens with large urban areas is that the disparities are not visible because we can't be granular enough in this index. It is kind of revolutionary that we were able to get all this data at the county level, but to really understand community, one has to get even smaller. So those that are working in the community will know that and can further like work with this data.
There
But
is
yeah.
there is an outlet in Minneapolis that we partner with called the Sahan Journal, which is probably around 4 years old. And they are actually the gap that they're filling, which may not turn up in this data so much, is related to immigrant communities and publishing in Somali language, Spanish, understanding those community information needs and reflecting that through their reporters, and also developing local reporters from those communities.
Yeah, so we see a lot of strengths here. We also see some weaknesses in some places where one just needs to interpret the data in context. So transportation, for example, is likely lower because it's an urban center and people don't need cars. And that's a different way of measuring transportation would lead to a different outcome here.
Stefanie, on the question here about has the index been validated? How do we know if these attributes translate into media engagement opportunities? I'm inclined to respond. We're working on some case studies and partnering with folks. We're also getting a lot of anecdotal feedback from, I mean, maybe it's worth sharing kind of some of the groups that we're trying to put this in the hands of, which includes foundations, academics, media outlets, community organizers. We're trying to also take a broad stroke with who we connect the index to and hopefully get feedback from on what they find useful about it. What would you add on that question?
So I think validation happens within journalism, but also outside of journalism. It's already been surprising to me how it's been picked up by organizations in the health space to think more about the role of public health and healthcare in the information ecosystem. In terms of concrete engagement opportunities, I know of a couple of newsrooms that are starting to use the index to try to build new tools around engagement. So for example, if there's a high library score, if that's something that the news organization hasn't thought about before, how can we bring more of what we do to the library? If there is high medical debt, what kind of coverage can we do that helps address this as a social issue in our county? Those types of applications I have seen.
Keeping with that thread, what do you think is a goal that you all would have for people to use the index? Because there is a lot of information there. We just looked at Minneapolis. Let's start with, like, if you're sort of in the public health space, what is one way you see kind of using this index to think about some of the work that you're doing?
Well, our goal here is, so one thing we haven't yet talked about, one of my big surprises about this project was the things that we can't yet measure or that we don't have good data for. So we are more connected than ever online, and yet we have a sense of belonging crisis in the country. And people feel like they don't belong to their community. We worked with an advisory group of folks from all walks of life in creating this. And one of the core, because when you create a project like this, it's never what data do we have and what can we do with the data that we have. The point here was to do an ideation on what does civic health look like and what is important to us as human beings and what's important to our communities. And then what do we have data for that we can measure? And one of the things that came up at the top of every list was belonging. We need to understand people's sense of belonging in our communities, and we don't have good data. So one goal for the project is that we can now start to work with, again, doesn't matter if it's health or power building organizations or newsrooms, to engage communities in that conversation around belonging. How much do you feel you're part of this community? If you don't feel like that, why? What is happening? Where are you being, are you being invited to participate? Where does that get facilitated? So that is part of and I truly believe that that is part of what we need as a country, that we at the local level need to be having these types of conversations. Again, we overfocus on where we disagree, and we overfocus on opinions instead of focusing on aspirations and how we can and want to live together. And that is something that the index allows us to do. And it allows us local, like we support them with all kinds of, like Jesse's team is great also with all kinds of, like, how do you build a survey? And how do you do these types of engagements that may not be so traditional to journalism or to public health?
I think also it's the collaborations you begin to see when you look at those data sets. So I'll just share another example. There's a news site in Memphis called MLK50, and they got interested in the topic of medical debt. They investigated it. They did a series on it. They looked at a specific nonprofit hospital that had its own legal team that was putting, it's a majority Black city, putting more lower income Black families in deeper debt and creating that content. But then again, I thinking about collaborations, it's then going back to folks like you all to share stories like that back out into your communities so people know about them, which gets them new examples and sources. And so they were even, relying on hospitals themselves, people who work at them, to share other anecdotes that contributed to their reporting. And then what happens in the end, that hospital started to forgive quite a bit of the debt that it was holding. And I think, hopefully, I think our longer term goal is what you see in the index, that some of these civic health measures begin to change over time. Is information impacting, some of these big issues that communities deal with? So I like to think, look at it and think of how it's interrelated, how many collaborators you can see when you look at that data. Often when I start mapping a community's information needs, one of my first visits is to a public health organization, because I know those are the places that have local connections, often have trust, know the community in a way that a lot of people don't, in a way that honestly media outlets might have or used to, and no longer have the staff or the time to do that, are really great at collecting data. And so I often knock on the door and wind up finding ways to collaborate with public health people. So yeah, it's exciting to look at outside of just a newsroom and think about how many people are working on this issue of information access, understanding what people need to know and how to reach them, and how partnering can actually, like, hopefully, and through this index, show some shifts in some of these outcomes.